as we talk about who is at risk of being gaslit more, the baby boomers or the Gen Z millennials? Well, if you don't know about gaslighting, it's very important, especially in medical contexts. If you've ever been interrupted, you haven't had any follow-up questions, a doctor that just isn't really being honest about their plan with you, you walk out of the appointment feeling confused. Maybe you've been told it's all in your head or you're overreacting. If these have ever happened to you before, let me know below, but you may have been gaslit. And you need to know what the risk factors are so you know what your risk is so that one, you modify it, and two, you are all the more prepared to advocate for yourself. I'll give those tips at the end. But first, I will share that there are no formal studies on this. This is just from my experience from the last 10 years of practice of who is at higher risk. I believe it's the boomers. I firmly believe the boomers are at higher risk, but Gen Z and millennials are right on their feet. Very, very close. So I'm going to break down why that is, and you for yourself keep track based in the different categories of what increases the risk and the modifiable risks. So please leave your questions in the comments there so that I can answer them. Please keep them on topic. But number one is the things that you can't control for gaslighting. These are the extremes of age. If you're either very young or very old, you're more likely to be gaslit because the power dynamic is that much higher. If you're a racial minority, we know that's also a significant risk factor. And being a woman and being disabled. Then the question is for the generations. When you're older or younger, go through this list here because this is important. One are supplement use. Some docs are going to be like, oh yeah, just take this supplement and you'll feel better. This is not all doctors, right? Most doctors are doing the right thing. They want to help their patients. But if you see that there is a penchant for supplements, well, we know that Gen Z is often more likely to go for supplements or millennials. That might put them in the higher chance of being gaslit because they're more likely to be recommended the supplements and just swipe something off the table and maybe not address it fully. More importantly is who is more likely to bring somebody into the appointment with them. This is super important because as you know from my other videos, bringing someone into the appointment with you will decrease your chance of being gaslight. Because it's hard to gaslight two people instead of one. I find that older individuals are typically bringing someone with them. Either it's their children or their spouse because they're married. Versus the Gen Z who doesn't really have a spouse yet, they usually don't bring their parents and they don't have kids yet. They're more likely to bring in backup with them. So therefore, they're at higher risk than the millennials in that category. Then there is who's more likely to whip out a pen and paper and jot notes. Because it's harder to gaslight someone if they're actively writing down what you're saying. I'll tell you as a doctor, it's just this bias where someone's writing everything down to a T. I can't help but think that, like, man, let me be even more careful because they're writing down. It's not like I don't care about other patients, but I'm being honest as a human being. When someone is actively writing stuff down, there is an element of pressure, which is not necessarily bad. But the Gen Z, and this is the total opposite effect, they're often the ones jotting notes on their phones. And it's like when someone whips out their phone during an appointment with me, I can't help but think, what are they doing? Are they texting? Are they playing Candy Crush? Or what are they doing here? And I don't mean it in a joking way to be mean or anything, but it is often interpreted as a sign of disrespect. And I'll tell you, it has the opposite effect. So this point goes in favor of the millennial because the millennials are more likely to be bringing out the old school pen and paper. And that will decrease the chance of them being gaslit. So that one, the millennials win. Next is the past medical history. The more chronic conditions someone has, the higher the chance that they're going to be called out that it's all in their head. So for example, if someone comes in with a history of anxiety and chronic pain, and they've been depressed, and they have had a stroke, and they've had all these other conditions, well, something else is going on where they're feeling a little bit, let's say, some indigestion. Oh, maybe your anxiety is just flaring up, or maybe it's just from one of the medications you're taking. In most cases, they might not be wrong, but are they doing a shortcut and not addressing the root cause potentially? So the more things that you already have that could explain that new symptom you have, the easier it is to chalk it up to that. Once again, it's not necessarily wrong all the time, but it could, in some potential cases, not allow for a thorough workup. And that's going to be present in the baby boomers because they are older, they've developed more conditions, especially chronic pain conditions, psychological conditions. Those are the two that when you have those two, you're more likely to be in that gaslit category. Because if you already are anxious, well, maybe this is also from anxiety. Or if you already have chronic pain, this is just a flare up of your chronic pain. That's the type of thought process that can happen. I'm not saying it happens all the time, but it's possible. The Gen Zers, fortunately, are too young in most cases to have developed these, though my heart goes out to those Gen Zers and Millennials who have had these really unfortunate things that happen to them. And they also are going to be at a high risk of being gaslit for those reasons. So that when on average goes to the boomers. I want to answer a couple of the questions coming in. Recording the office visit. Thank you, Heidi, for asking. You, in most states in the United States, you're not supposed to bring in a recorder and not tell anyone else it's there. Some parts of the world, I know some viewers from out of the United States do this. And all I can say is that it's probably best to let the physician know that you're recording them because one, it's kinder for them, they'll appreciate it. But two, you don't want to come off as being dishonest with your physician and you don't want the physician to be dishonest with you. So great question. Another one, do I observe the age demographic of those doctors who do the gaslighting? That's a tough one. And there are so few data points because there are way more patients than there are doctors. And already I'm giving you anecdotal evidence, if you will. I'm not giving you peer-reviewed evidence because it's already so difficult to measure. If you try to measure it in an even smaller population, aka doctors, it's even harder to extrapolate anything meaningful. So I wish I hadn't answered such a good question. Before I go back to that criteria list, though, for you, if you do appreciate me coming on these lives and you're learning something new and sharing with your loved ones so that they can better advocate for their health, I'd appreciate it if you support me. Either leave a comment or hit the like button below, or you can join our Medical Secrets exclusive access, where you can join our private live streams to ask me questions in our smaller setting. We meet twice a month minimum, and it's a great opportunity to learn more. I'll try to answer as many of your questions here as I can, but I can't keep up with all of them. Moving on to the next one, which is the cognitive dysfunction category. Patients that have cognitive dysfunction, think Alzheimer's, dementia, TBI, traumatic brain injury, these individuals are already cognitively delayed in some ways. And unfortunately, time and time again, they're more likely to leave being gaslit. I don't think doctors are bad doing this. It's just when there's already so many problems going on, if someone isn't fully there, it might be easier for that problem to be chalked up to an exacerbation of an existing problem, perhaps, as opposed to the full workup for what else is going on. These are challenging situations, but the baby boomers are more likely to have experienced that type of cognitive decline versus young people. So that also is a strike against the baby boomers and their risk of being gaslit. Next is allergies. The more allergies a patient has, this can lead to serious biases. Not all of them are unfounded, but oftentimes, if someone has 25 allergies listed, there is something else going on because most human bodies don't have 25 allergies. Unfortunately, instead of saying, why does that person have 25 allergies? It's easier just to say it's all in their head. Instead of address, well, why is this body so wound up that so many exogenous medications are triggering it by an allergic reaction? And it's quite challenging to put that aside in a brief hospital doctor's appointment, and they're more likely to be gaslit. Well, baby boomers are more likely to have those long allergy lists because they've been exposed to more medications versus Gen Zers or millennials. So that's another strike against the baby boomers. A couple more questions here because I can't keep up with all of them. I'm trying. If you are a physician, how do you ask for more pain meds without pulling the I am a doctor card? You mean if I'm a patient and a doctor at the same time and I need pain medications? That's a good question, but do you mean like around surgery? If you clarify, Heidi, I will try to answer that. Really good question. What do you do if you finally stick up and be demanding and they still ignore you? What can you do? Okay, we'll talk about that at the end when I give the concrete tips for gaslighting. So hold on to that one. I have one last category I got to go through, and that's substance use disorder. This is a big one that most patients might not be aware of, though I know some are, because the more substances that are used that end up in the medical chart, there is a bias. I'm not saying to be dishonest with your medical professionals. You should absolutely be honest. The patients that are dishonest with me, it can be life or death consequences, because if they're coming to me for anesthesia and they don't tell me that they use cocaine, heroin, methamphetamines, marijuana, etc., that can have disastrous consequences to their surgery. So you need to be honest. Unfortunately, the more substances that are used, and if there's a substance use disorder, then that might also increase the risk of being gaslit. It's unfortunately true. I'm just being honest with you about the healthcare system. I'm not saying to be dishonest. Please do not take it that way, but recognize that the longer the medical chart is with some of these diagnoses, the more that we need to be empowered to advocate for ourselves respectfully. That's why I'm sharing this with you, so that you can also share with your loved ones, and so that you can hopefully advocate for them. But boomers are more likely to have a substance use disorder diagnosis, more likely to fall into that category. Though Gen Zers and Millennials are rapidly catching up, especially with marijuana. And cannabis use disorder is a very real phenomenon, and is, especially in the San Francisco Bay Area where I practice, growing very, very fast. So as for now, the millennials have the leg up, but Gen Z and baby boomers have the strike there, but the other generations are catching up. So if you tally that up, you'll see that baby boomers win out. But that's not the biggest reason why baby boomers are more likely to be gaslit. And this is the real tough, heart-wrenching part to me. And that's that they have often been gaslit so many times and had their trust betrayed in our broken healthcare system so many times that they've sometimes lost the will to even fight. The number of comments I've had from viewers like yourself who have been vulnerable and shared that they just don't even want to go to see their doctor anymore because it's the same thing over and over again. That breaks my heart that the system has failed them so many times. Their trust has been betrayed. When trust is betrayed, this can lead to PTSD. And the fact that we see so much medical PTSD is not by accident. And I'm saying this in all seriousness. Baby boomers have lost the will to fight. And if they have lost that will to advocate for themselves, they're going to be more likely to be gaslit on top of all the other categories that I shared. And that is what I want you to take away. I want you to hopefully maintain your resilience and help those around you, especially if they are boomers. They have the card stacked against them. Some boomers may have limited support. They may have lost their partners. They may not have parents anymore. So if your parents are a baby boomer and you can help them by being supportive in their visit, show up with them to be helpful, to minimize that risk of them being gaslit. So their concerns are heard, so they receive the care that they deserve. And remember that regardless of what age you're in, the concrete steps are, number one, bring a family member because it's harder to gaslight two people than one. Please bring a pen and paper. If you can avoid not writing things on your phone, it's probably best, but better than nothing, as long as you explain to your doctor why you've taken your phone out. And then always, number three, ask for a plan. Make it very clear that, doctor, I want to know what the plan is. You do not want to walk out of that appointment confused or unsure of what to expect. So I want you to ask your doctor, what is the plan? The more concrete you are with them, the more concrete they can be with you. And the more concrete everyone is, the less the chance of gaslighting. We'll get to Gen X, Phil. I see your comment there. Give me a moment, please. You always want to, number four, be eye level. So if they're sitting down, you can sit down with them. If they're standing up, stand up to meet them. Eye level, make the power dynamic less. Same category there is you want to, if you're wearing a gown, dress into your regular clothes again before you talk to them, before they leave, So it's not like your butt's, free floating and flapping in the wind. You want to be dressed and maintain your dignity to once again minimize the power dynamic. And then lastly, rehearse what you're going to say. You want to maintain your composure as much as possible. And then you always know that you can ask for a referral. You can always ask for a referral. And it's kind of like the last trick up your sleeve. Hopefully, he doesn't have to go there, but you can ask to be referred out for a second opinion. It's always within your power as the patient. Very good questions. And Phil, about Gen X. I didn't bring up Gen X because the two extremes of age are typically the risks for being gaslit. And the extremes currently are the baby boomers and the great generation, et cetera, and then the very young or the younger Gen Z and millennial. As always, if you appreciated me coming on here, hit that like button, please, and share with others, and subscribe to keep up with all of my lives and other videos. Your support helps me do this more often, and you can always consider joining the exclusive access for our private streams, and that link is in the description below.